Alright, hello everyone. My name is Rebecca Seamus. I'm going to be talking to y'all today about eating disorders, okay? An eating disorder can be simply defined as a psychological disorder which is characterized by irregular or unhealthy eating habits. Now we have our two main disorders. We have anorexia nervosa and bulimia nervosa, which are the two more popular ones in our society. We also have some more minor eating disorders like binge eating disorder and some other ones that we will be talking about. So in America, we do have about 30 million people that do have eating disorders. Eating disorders can be severely dangerous because there is no ultimate cure. It's something that an individual will most likely battle their entire lives. An eating disorder can be helped through many treatment options. And it also occurs in about 1 to 2% respectively of the young adolescent female population. So we're going to begin by talking about anorexia nervosa. Now, anorexia nervosa is a psychological disorder characterized by the fear of gaining weight and also a lack of appetite with food. So an individual with anorexia nervosa completely cuts off their intake of food and also can go and excessively exercise to the point where it's like unhealthy. Now, anorexia nervosa is dangerous because it does not give your body the essential nutrients that it needs. So it's you're on a very low calorie diet and stuff like that. It can cause your body to shut down. It causes osteoporosis, which is the brittleness of your bones, which can make your bones break easier. It can completely transform your body, sometimes so severe that you can't even recognize a person and someone is so skeletally thin. Anorexia, aside from these physical characteristics that it gives your body, it also affects your mental state of mind, your physical health. It can lead to depression, anxiety, lack of control. You feel a lack of control because you can't control the thoughts that you're having about not wanting to eat, stuff like that. On the other hand, we have bulimia nervosa, which is it can be characterized by the psychological disorder consists of the continuous cycle. So these people with bulimia, they do, unlike people with anorexia, they have a large intake of food, but then follow it with a compensatory action of purging. So these people that purge, they can force themselves to vomit, or they can also to have an excessive exercise routine following from the purging acts. So unlike anorexia, bulimia is very hard to catch because you are not losing the extreme weight that you are like in anorexia. So these people with bulimia, they do not have a severe weight loss. They can also result in, this kind of bulimia disorder results in clinical obesity, can result in high blood pressure. It can also result in acid reflux due to the purging. And this is also severely dangerous because it can completely damage your nervous system or your digestive system. And like anorexia, it also has many mental effects on you because you have this feeling of embarrassment and stress and guilt because you're trying to hide the fact that you do have bulimia, unlike anorexia where it's more obvious. And you have guilt, the negative view on yourself and on other people, stuff like that. And also, along with bulimia nervosa, a lot of people also have a coexisting disorder like anxiety or depression. Now, other eating disorders, there's the binge eating disorder, which does result in obesity. It's a big reason that some people are obese in America. It can also lead to gallbladder disease, stuff like that. There's some other disorders that include orthorexia nervosa, pica, and night eating syndrome, which is where you eat obsessively, like right before you eat or right before you sleep, or when you wake up, stuff like that. Now, along with the factors like someone's mental health or their physical fear of gaining weight, other reasons that you may result in an eating disorder is media. Media is a big thing in eating disorders. So mostly females, of course males as well. They look towards models and our fashion icons that we have on magazines, TV, and they want to look like them, want to be like them, because that society makes it acceptable to look like these people that pay thousands of dollars to look the way they do. And that's just how it is in our society these days. The media creates this false sense of beauty through their productions like TV. And then teenagers also tend to look at social media, Instagram, Twitter. They tend to look for acceptance in others. They want others to like them when some of these people don't even like themselves. Of course, there are treatments. Most treatments consist of therapy, different cognitive therapies, commitment therapies, stuff like that. Writing in a diary or talking to a friend can also, of course, help. Creating a diet plan, stuff like that. With eating disorders, overall, eating disorders, it's very dangerous. There's no overall cure. It's just something you have to look to a friend, help out with. And I feel like overall, as a society, we need to work together to make sure that everyone feels accepted, all body shapes are accepted, and just support one another. You never know who you know around you that would have an eating disorder. Thank you so much. I appreciate it.